Okay, so welcome to the video. We're going to go through how you might approach a sensory examination if you're ever asked to do a sensory examination of a patient. So David Llewellyn, one of our registrars, very kindly agreed to help out make this video. So I'm going to talk through how to test the four main modalities for the sensory exam. Soft touch with some cotton wool, pinprick testing for pain. Temperature is quite difficult to test in the clinic room, so we don't tend to do that unless you really need to assess for temperature. Then we'll check vibration sense and joint position sense. So we'll just run through that. I normally just start from top to toe really when doing the sensory testing as a screening test. So David's got cotton wool. Have the patient close to the anatomical position with the hands as David has positioned them here. And test one side against the other. So we'll go through that, David, okay? Tell me if you feel that is soft, and if it's the same on each side.
Soft and the same.
Okay.
Yeah.
So you're testing each of the branches of the trigeminal nerve, and down into the cervical distribution. Don't tend to test every single dermatome, but this is just more of a screen for whether there's any differences each side, or differences, suggestion of differences in level. All similar?
All similar. Yeah.
Okay, and it should really be a touch rather than a swipe. That's a different sensation. It's very much a touch for the cotton wool.
Yeah, all the same. Same.
On the leg.
Same. 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 Same.
Okay. Next we use the pin, so pinprick testing or pain testing. Same thing again, same approach. So you just tell me if that feels sharp.
Yeah.
And does that feel the same on each side?
Yeah.
It's quite a light pressure. You don't want to pierce the patient's skin.
Yeah, sharp. Yeah. 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 Sharp. Sharp. Yeah. Yeah, sharp.
Okay, that's great. Now if you do detect that there may be an abnormality, for example in the legs, not in the arms, you may want to do a testing for sensory level, in which case you then want to go up with a pin until you find where the sensation becomes normal. We won't do that just now, David's sensation is normal. So for vibration sensing, it makes more sense to do this distally to proximally. So you take the tuning fork, you want to put it on a hard point on the digit. Can you feel that, David?
Yep.
Okay. And again on this side.
Yep.
Okay, so for most people that's normal. You can time it, so patients should be able to feel at least 15 seconds of vibration. So we can do that with David. Tell me when the vibration stops, David.
That's stopped now.
Okay, so 23 seconds. You do the same on the feet. Can you feel that vibrating?
Yep.
Can you feel that vibrating?
Yep.
Okay, and again, you can time it if you're worried there may be a problem. If the patient can't feel the vibration distally, you just move proximally. So you can check at the next joint,
Yep.
the next joint,
Yep.
the dorsum of the foot,
Yep.
at the ankle,
Yep.
and so on, up the body, always pressing the tuning fork onto a bony prominence. So now we're going to show you joint position sense testing. So we'll show you on David's left thumb here, and what you want to do is hold above a joint you're testing and hold below on the sides rather than top and bottom, because top and bottom, you can trigger the baroreceptors, which the patient can feel. So you really want the patient to tell you about whether they feel their thumb going down or up.
Yep.
Okay, David, and it's small movements. The smaller the movement, the more sensitive it will be for examination.
Down, down, up, down,
Okay, and again on the right thumb,
down, down, up.
you could test all the digits, but you only really need to test one, especially if you're not really expecting much of an abnormality. We'll check that on David's great toe as well.
Down, down, up, down, up, down.
Okay, and similarly to vibration sense, you can move up if the patient can't feel the movement. So
Down, down,
okay, and you can even do so at the ankle.
up, up, down.
Even at the knee. We won't go any higher than that. Okay, thank you very much, David.
Thank you.